Sanchez?
What? I can't hear you.
Oh, let me try this side.
Oh yeah, this is my better side.
Good morning, Mr. Sanchez. I see you're here because you've been experiencing some dizziness and hearing trouble. Can you tell me more about what brought you in?
Yeah, my ears, they've just been ringing and they feel so full and I just can't hear.
Okay. Well, I'm sorry you're feeling this way. Let's get you comfortable and assess what's going on. Let's pause here. What actually is happening in Meniere's disease?
In Meniere's disease, there's a buildup of fluid called endolymph inside the inner ear. This happens in the membranous labyrinth, which is part of the inner ear that helps with balance and hearing. Normally, your body keeps endolymph levels balanced, making just the right amount draining the extra. But in Meniere's, that balance is off. Either too much fluid is being produced or it's not being absorbed properly. As fluid builds up, pressure increases inside the inner ear, and this pressure disrupts how the vestibular system for balance and the cochlea for hearing work. That's what causes the symptoms like vertigo, hearing loss, and ear fullness.
I'm going to perform a quick assessment. Any nausea or vomiting today?
Yeah, I threw up this morning and I feel really seasick.
That sounds rough. Let me get your vitals and do a quick neuro check. So what are the classic clinical signs I should be watching for? Another common symptom is hearing loss, especially in one ear. At first, the hearing loss may come and go, but over time, it can become more permanent. People with Meniere's often notice tinnitus, which is ringing or buzzing in the ear. You might also feel a sensation of fullness or pressure in the affected ear, kind of like you're on an airplane. Some people also feel off balance or unsteady, especially after a vertigo episode. These symptoms don't usually happen all the time, instead they tend to come in episodes that can be unpredictable. You might have several attacks close together, followed by a period where you feel okay. I know this can sound overwhelming, but people that have this are not alone, and we're here to support you. All right, Mr. Sanchez, the doctor is going to prescribe you some medication to help with your vertigo and your nausea. I'm gonna raise the head of your bed. Okay, and I'll keep the lights low to help with comfort. Now, what are the key medical and nursing interventions for Meniere's?
Well, Sherd, when you're trying to figure out which medications to use, it's helpful to remember the pathophysiology. When the client has too much fluid inside of their vesicles, then they can take a diuretic to help relieve some of that fluid. They can also take beta histamines to increase blood flow to the area. Also, to help the client with their vertigo symptoms and nausea, you can use an antiemetic such as Valium.
Well, Troop, some key nursing interventions for Meniere's disease include keeping the patient in a quiet, dimly lit environment to reduce the headache and dizziness that light can cause during vertigo episodes. Use fall precautions such as a walker or a cane during vertigo episodes. Avoid sudden movements, so if you're getting up from your chair, go slow. And positioning the patient to help reduce nausea and dizziness.
All right, Mr. Sanchez, before you go, let's talk about how to manage your symptoms at home and reduce future episodes. What should I include in patient teaching?
We really encourage you to stay hydrated to maintain proper fluid balance, which will help you keep your balance. Next, we really want you to adhere to your medications, especially the diuretics and anti-vertigo agents. This is going to help reduce pressure, any swelling or dizziness. All right, we want you to use assistive devices if you need any during vertigo episodes to prevent injury. We're going to refer you to an ENT specialist for audiology assessments. And finally, we encourage you to start a symptom diary to track episodes and potential triggers.
All right, so we've gone over your discharge plan. You're not alone in this. Feel free to call us if symptoms get worse. And just take it easy, and until your ENT clears you, just no driving until then.
Thank you so much, Nurse Troop. You've been so helpful.
You're welcome. Take care of yourself. In Meniere's disease, there's a buildup of fluid called endolymph inside the inner ear. This happens in the membranous
We almost got it.
We really encourage you to stay hydrated to maintain.
So what are classic clinical? Dang it!